You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have Central Mississippi's go-to implant dentist, Dr. Keith Klaus. Dr. Klaus, welcome to the program.
I'm glad to be here.
So before we get into today's topic, and I know you brought a ton of photos, so we'll get to as many of those as possible, but for people that don't know your dental implant center, who's the typical person getting dental implants?
So we're blessed in our office to be able to offer implant options to a wide range of patients, but I'd say they probably categorize into one of two groups.
Okay.
First being that typical patient who has been what I call on the dental treadmill, right?
Okay.
They've been huffing it and sweating, thousands of dollars a year spending on failed fillings that turn into root canals, crowns, and then they start breaking down, and now they're in a position where it's almost miserable for them to continue going on with the teeth the state that they are. And for those people with their teeth that we're really in a position where they all have to be removed, instead of a denture, which is what they hear often.
Okay.
We can offer an option where we have teeth that are in their mouth that they don't come in and out.
Okay.
They're fixed in their mouth to dental implants.
That's nice. And who's the second group?
So with the second group, that's the and I like analogies.
All right.
So follow me here. And so for that group that's been on that treadmill, their shoes have holes in them.
Okay.
And so at some point they jump off the treadmill because somebody's told them that they needed a denture, but they're jumping into flip-flops. Imagine running a marathon in flip-flops. And yet that's what these people are doing. So that second group of patients with those dentures are sitting at home, and half the time they're not even wearing their dentures. They call them their Sunday teeth, in Mississippi.
Is that right? Okay.
So you have this group of patients, and we can help them. We can give them a set of teeth, upper and lower, that don't come out.
Is that rare or is that common in your practice?
We do it every day. And we see the transformation every day, and it goes beyond just them being able to eat. We're improving quality of life through their smiles.
Okay. Now we should mention to start this off that at the top of the show I said that you were like the go-to guy for dental implants, but everything we talk about today, you're teaching other dentists across the country. Is that right?
That's correct. That's correct. I've had the opportunity to get involved with some people who are teaching how to do what we're talking about on a high level, and keeping that same high level dentistry, but break it down into maybe 2 or 3 appointments instead of the traditional 8 to 10 appointments.
Is this true, like a denture wearer on the day of the procedure could walk in with no teeth on the actual day of the procedure and walk out with upper and lower teeth that don't come out?
Absolutely.
Is that right?
Absolutely. I can confidently say yes.
Now, you travel even out of the country to learn this. Is that right? Is there that much to it?
Yeah, I've traveled out of the country to teach this.
Okay.
Yeah. It's not just Mississippi. This is a worldwide problem. There's people all across the world who are hurting from having a set of teeth that's hurting them, causing infection, keeping them from being able to smile. It's holding them back from being, showing the world who they truly are.
Okay. Now, correct me if I'm wrong. I guess the way dental implants are typically done is in 3 different places. You go one office, dental office, to get the surgery done, another office to put the teeth on top, and then you get them maintained elsewhere. Now, your office does all 3 parts. Is that why you do it so quickly?
That's correct. That's why we're able to do it so quickly, but at the same time, we're keeping a very, very high level of dentistry, right? So everything we do in our office is custom. When we do these cases, if you were to come to my office, the first thing we're going to do is, of course, I'm going to learn about you. I want to get to know you and your family. You become part of our family. But I'm going to acquire data, right? We're a very, very high-tech office. So instead of the goopy impression, we're going to take an intraoral scan. But I go a step farther.
So it's like a scanner that's rather than the goop that you put in your mouth?
Yeah.
Okay.
I just take a wand. And I can scan your teeth, and it takes a matter of minutes.
That's nice.
But beyond that, right? Now we can scan the face. So at that first appointment, you leave. I have everything I need to be able to design your new set of teeth. right? So we talk about things like, what would you like your smile to look like? And what I'm able to do with the technology is I can design exactly what you want, exactly. So I have patients that will bring me pictures from their high school graduations.
Okay.
Or I have a patient that says, hey, I've always wanted a smile, like this, right? And so being able to do that in our office translates to the next step, right? So we talked about 2 or 3 appointments. Well, what do those look like? First appointment's data acquisition, right? We gather data. I digitize you as a patient. So now when you leave, I can work on it, or my lab technician can work on it.
Okay.
The second part is the design. So that kind of happens behind the scenes. And so we take all your input, all the things that you've told us that you like about different aspects of a smile, right?
Okay.
But I'm also looking at you as a person, like your personality. I want to even put your personality into the set of teeth for you.
Okay.
Yeah. So the design aspect occurs. And on the second appointment, the patients come in and they leave that day with upper and lower teeth that are fixed to their jaws.
Supported by implants.
Correct, supported by
Is
implants.
that common or that's rare? You could do it that quickly.
So that's a great question. That's part of the reason why I like to teach, because it is so rare. It's so rare, especially in our state. There's only a handful of us, maybe in the entire state, that are able to do it this way.
And nobody in your town is doing it this way.
Nobody in our town is doing it this way.
Where they have like the lab, they're making the teeth right. You print the teeth in the next room?
Yeah, printed or milled, either one.
Okay.
Yeah.
Right there.
Right there.
All right. Yeah. Now you brought some photos. What do we have?
Yeah. So this first gentleman, so this is Tori.
Okay.
Tori's a mechanic. And Tori's a great guy, and he has just this huge, personality. He comes in, we know when he shows up in the office.
Okay.
And so one thing, he was out looking for another job, and he one of the issues that was holding him up, and I'll show you here,
Oh, wow.
he's missing his lower teeth.
That's him?
That's him.
Is that unusual to have teeth this bad?
It's really not unusual. As dentists, we see it every day. The reality is, Tori, he smiles with his top teeth. You don't see his bottom teeth because he covers them up.
So they hide it.
He hides it.
Okay.
But he knew when he goes in front of an interview, he's having a conversation like you and I are.
Yeah.
We smile with our top teeth. We speak with our bottom teeth. And he was going out looking for a new job, and he was wanting to have an upgraded version of his bottom
So he was
teeth.
self-conscious, he told you.
Absolutely. This guy's been avoiding a denture his whole life.
All right.
Because that's pretty much the options that he had been given, prior to coming to our office. And so we were able to talk with him and explain to him that we had a solution for him.
Okay.
We gave him a new set of teeth, upper and lower, fixed to dental implants. So he can eat whatever he wants, he can smile.
Those
and
look
more
good.
importantly, this guy's confidence level, when he came in and I asked him, I said, what are you looking forward to the most after getting this procedure done? And he said, I want to look in that mirror and I want to smile. I want to see myself smile. And the great thing is he brought his father and his mother in with him.
Okay.
For the reveal. So we always do a reveal after, for these cases. And we make it a big deal.
A reveal meaning you're showing them what their new teeth look like?
Correct. And so they come in and we insert the new upper and lower teeth, right? And we bring in, our team. We get around. We make sure that they bring loved ones who want to see them, and they get. It's great for team building. It's great for the patients. It will be something that he never forgets.
Okay.
And so it was so great on that day. His mother, the two people that care about him the most, were there to watch him see himself in the mirror for the first time. And
What's it like for him, by the way, when he sees that smile for the first time?
Oh, he loved it. He absolutely loved it.
Do they get choked up?
Yeah.
Sometimes?
There's tears, there's high fives. It's why we do what we do as a practitioner, right? But look at the before for a second.
Yeah.
And keep in mind, he had no lower teeth. And what I didn't tell you is he actually had 2 broken teeth in the front. So, a dinner night at Tico's, there's no way he's having a steak dinner.
So with teeth that bad, he can't eat like pizza or chewy things or salads?
No, it's a struggle.
Do you hear this a lot?
All the
from
time.
people?
And so now, I have no doubt that this guy's out there. He's eating whatever he wants. If he wants to, bite into, Snicker bar, something simple like a Snickers bar.
Okay.
He can do it. He has, his personality is still there.
So could he eat like a corn on the cob, bite down with the front teeth, or he have to be careful?
Yeah. No, he can eat whatever he wants at this point, right?
Okay.
So anything you can eat with normal teeth, and probably then some, this guy can now eat. But the food and everything is one thing. But imagine going out, and imagine going dating without any lower teeth. Remember, he's got no lower teeth.
Oh, that's right. I meant before.
So, the small things, the day-to-day things that we take for granted, we've restored in this patient.
Now, when you're on a consult with this guy, and let's say he's already decided he's going to do it, but in your mind you think he doesn't even know how good this is going to be. Does that go through your mind?
Absolutely, yeah. And I'll even look at them, and that's part of the acquisition phase, right? That first appointment. I'm getting to know them, but I'm also looking and saying, hey, I know what I'm gonna do, right? So in my mind, I know, and by the end of the appointment, I'll look at the patients. We'll come up with a treatment option that they're happy with, right? And I can tell them this is gonna be incredible. This is going to do everything you're wanting and more.
How old can you be to get this done? 75, 80?
I've had my oldest patient I've had to do this, 94 years old.
Really? Why would a 94-year-old do this? I asked your partner the same thing.
Yeah, well, I'll tell you, this particular lady was very special. Every time she came in, she brought me a bag of pralines. You know what pralines are?
No.
So it's like a candy, right? And they've got little bits of pecans in them. And so you want to be able to eat what you make. This was something that everywhere she went, she was the praline lady, right? She couldn't eat them. So imagine, being proud of something that you can't enjoy yourself.
So at 92 or 94, you're not too old, meaning they're not more likely to fall out?
Absolutely not.
Okay. So 70-year-olds, I think we talked about this.
Yeah.
They might come in and think they're too old. They're not.
No, no.
Not even close?
Yeah. As a matter of fact, let me show you this next patient.
Okay.
So take a look at her. And so this was a caterer. This woman catered food for a living. Okay. She fell down a flight of stairs around, when COVID, right?
Wow.
hit. And so she knocked out half of her teeth, but she was saved by COVID.
What do you mean by that?
So the masks,
Okay.
right? There's a group of patients who were relieved when COVID hit because they could wear a mask.
And hide their teeth?
And hide their teeth.
They told you that?
Absolutely.
Okay.
And she's one of them. So she comes in to me, and there's no doubt that, another office had given her options for dentures, right, coming in and out. And so, don't think about her age, don't think about anything else, just understand this is a lady who food and entertainment is her life, right? And so this is a close-up of what her situation looked like. Oh boy. Yeah. So again, she fell down a flight of stairs, and she's still working, by the way, but she's got the mask.
So is this right up your alley? Like when you see this, your skill set, you're thinking this is going to be good.
This is a chip shot.
Oh, really?
This is a chip shot.
Okay.
Yeah. Take a look.
Wow.
So at this point, any reluctance to go out in public, any reluctance to eat, all that's out the window. And we did this minimally invasive, right? So every case is different. We're not just looking at, how do we get we're not just looking at the set of teeth for this particular patient. It's how do we get them that set of teeth with as little pain as possible in as little time as possible. Everything is customized. She was a chip shot.
So it was easy for you.
It was easy.
And what does she say, like when she sees herself for the first time?
Sees herself.
And how long did she go like that, missing that right side?
Oh, months.
Okay.
Months, yeah. It's interesting, in our state, probably the biggest thing, the biggest issue that's getting in the way of these patients is understanding their options. I feel like it is, if this patient had known ahead of time, hey, I can have teeth that don't come in and out, that are fixed with dental implants. As soon as this happens, she's going to call, pick up the phone and call. But the reality is, we haven't done a good enough job of educating the general public on what their options are. So
they don't know their options, so they don't do it. Is this a big problem in the state where people are wearing dentures? Are there a lot of people wearing dentures?
Oh, absolutely, yeah.
Like tens of thousands?
Tens of thousands. And there's the other studies that show there's millions just in the U.S. There's millions of people in dentures.
I think you told me like 30 million people approximately might have denture. There's not even enough dentists to help them.
No.
And if they all knew how good it was, in your opinion, do you think they would all do it?
Absolutely. Yeah. I mean, so let's think about this, right? And I like analogies. Okay. Orthopedic surgeon. How many knee replacements, how many hip replacements are done in this country?
Lots.
Right? Lots. Have you ever seen an orthopedic surgeon, or ever heard of somebody go into the orthopedic surgeon and them saying, patient coming in and saying, hey, instead of the knee replacement, I just want you to take the leg off? Never. That doesn't happen, right? No, we fix the knee. So we're at a situation in dentistry today, right, where patients, we can just fix the problem. There's no need we don't have to cut the leg off. We don't need something to slide over the top.
So the future of dentistry, do you believe, whether it's 20 years or whatever, that dentures as we know them will be gone? Everything will be attached to implants someday?
Absolutely, yeah. We're doing it now. I mean, the future's now. It's just a matter of spreading that word, and it starts with a message. Right? It starts with a message.
Now, dental implants are not covered by even the best dental insurance or Medicare or Medicaid, but you say some people finance it or they figure out a way to pay for it.
Correct, yeah. How many people go out and pay for a car with cash?
Yeah,
right?
Probably few.
Very few. So one thing that we've done in our office, we've brought in finance companies. Now you can spread these payments out over several years, right? Sometimes 7 to 10 years you can spread these payments out. It's not our intention, to strap somebody with something, a financial burden, right? So in our office, as we mentioned before, keeping everything in-house also allows us to reduce the cost.
Because you have your own lab, you make the teeth right then and there.
It's all done in office. It saves us time, it saves us money, and we make sure that we pass those savings along to the patient.
Now this is unique, is that correct? I mean, across the country, less than 1% of dentists are doing it this way. Is that fair to say?
That's fair to say.
So it's fairly a new thing, and it's just getting the word out there. Is this a word of mouth kind of a thing? Like somebody gets it done, then they tell their spouse or friend?
Yeah, I think it does. It starts that way, and like for instance, these patients that we're talking about, they run into people, and my goal is for their loved ones, their family members, their coworkers to look at them and say, Randy, you look great. Not who did your teeth, right? It's you look great, because it's just part of who you are, right? It's just something that we've made better.
Now, what about the person wearing a denture for like 10 or 15 years? Is it true you can't do this because you don't have enough bone to do it?
I get that question all the time from patients. They'll come and they'll say, I was told, by so-and-so down the street that I don't have the bone. I don't have the bone for this. And, the reality is that's typically not the case. We can grow bone. Or we've got specialized implants, that can still treat that patient who may not have enough bone to the guy down the street, but in our office, we have the ability to still treat them.
So you haven't had to turn somebody away because, hey, you don't have enough bone?
No. Okay. There's almost always an option.
Now we only have a few more minutes left, so I'm going to rush you, and I know you have a stack of photos.
Yeah. So here, let's take a look at this next guy.
All right.
Okay. So this is Bubba, right? And Bubba's a mechanic. But again, loose teeth. Is this a common theme yet? Loose teeth. Hurting teeth. Gum disease, infection. Okay, this guy had a mouthful of infection, so he knew that his next step was probably a denture. Until he came into our office and he asked about implants, and so with dental implants, we're able to give him again a set of upper and lower teeth.
Wow. Okay.
That don't come out. They don't come in and out. He can eat whatever he wants now. But I want you to look at the before and after side by side. Okay? Look at the before and then look at the after.
Yeah.
Would you say he looks more friendly?
For sure.
Would you say he looks more handsome?
Yes.
More sophisticated?
Yes.
Yeah.
Even more educated.
More educated. Yeah. If you were gonna, which one would you hire? Right?
Yeah. I guess the one with more charisma.
Yeah.
Not necessarily the one with the better teeth, but but I guess they're smiling, they're happy.
The strange thing is, I see this transformation, and it's not just that first day. They come back 2 weeks, 3 weeks, 2 months,
Yeah.
3 months later, and you can tell it changes. There's a lot of muscles that are involved when you smile. And for a lot of these patients that just don't smile, they don't have, they have almost muscle atrophy. And so what's really interesting is you'll see that lip kind of start hiking up. You'll see the eyes perk up, and it just continues and continues and continues. Here's Ivory. It's the next one I want to show.
All right.
And so Ivory had, 4 or 5 teeth left in his upper jaw. And so, again, what options do you think he was given?
A denture.
Denture.
Okay.
And so, here he is. Here's a close-up.
And a lot of these people, by the way, it's not so much they never brush their teeth, that they had a gum infection. Is that right? That kind of destroys their teeth?
That's correct. That's correct. And what you'll see too is they have a gum infection. They go to the dentist. The dentist says, I can't help you take the tooth out, right? And that happens over the course of years. This didn't happen overnight.
Okay.
But the reason that you see a lot of these patients that still have, why does he still have 4 or 5 teeth? Well, it's the fear of going to a denture. They have family members who have dentures. They have colleagues that have dentures. They don't want a denture. And
So what did you do for him?
So here he is after, and he's a
Very nice.
Again, bigger than life personality. He shaves his beard. He's lost 20, 30 pounds. He brought us fruit on a tray, in his nice new suit.
Okay.
I mean, this guy's living life, to the max now.
And he eat whatever he wants.
Eat whatever he
What
wants.
do they like? What it looks like, or what they could eat?
It's a toss-up because a guy like this, I mentioned Sunday teeth, right? So a denture can make a smile look decent, right? But it has to function. The reality is, these patients will come back and they'll say, hey, I love how they look, but I like even more how I can eat whatever I want. That's a tough question. It's a tough question to answer. Because I would say they're both kind of neck and neck.
Okay.
Some patients, want to do it just for the being able to chew, and then they realize, how many compliments they get on their smile.
Okay.
And so it's there's a lot of psychology behind a smile. They've proven that, people who smile more live longer.
Okay.
Do you know that? You may not have heard about this study.
No, I think happier people live longer, right? So if they're happier, maybe that has something to do with it.
So
they're eating better.
Yeah, no, they actually did a study. They looked at baseball cards from the Major League Baseball players in the 50s. And they looked and they counted, and they looked to see which players were smiling and which ones were not. And I bet you can guess they found the people smiling on their baseball cards lived an average of 7 years longer.
Now that's interesting.
Isn't that interesting?
Yeah. Great story. Now we're short on time, and I know you still have a stack of photos. So about 2 minutes left.
Yeah. Okay. So we'll go pick it up a little bit more. All right. So this is another guy. He's an architect. Very nice, very quiet guy, but just phenomenal. Okay. He comes in and almost the same story. 3 teeth, wanted to avoid a denture. Everything he could do to try to avoid a denture. Comes in. Hey, what are my options? And of course, we know, as providers, we know what the best options are for him, and it's teeth, right? It's not necessarily the implants or the process.
Those look good, by the way.
Teeth.
They look real.
Yeah, this is 2 weeks later, 2 weeks, and he looks like this. Okay, his personality has opened up just in 2 weeks. His personality opens up a little bit. He speaks a little bit more. He
So
smiles
he would have been in a
little bit
denture
more.
as well.
100%.
Okay.
100%.
Time for a couple more.
Okay, so this is another case, and so this patient
And
lost.
these are all people that would have been wearing a denture.
Correct.
Is that true to say?
Yes,
Okay.
yes. And so here's a patient. She doesn't have any back teeth. Right, so she's lost her back teeth, and what tends to happen is when you lose your back teeth, you have to chew on your front teeth, and they flare out like this.
Okay.
Okay. And so what we're able to do again with the processes, this 5 years ago, this is a difficult case to manage. Right, we're opening up the bite. We're doing a lot of things that are very complex. It's a complex treatment, but take a look.
Looks good.
Yeah.
Wow, she looks a lot younger.
2 weeks later. Yeah. And so, again, she looked happier.
Yes,
Yeah.
for sure.
Yeah, she looks more sophisticated.
She does.
Yeah. Okay. Let's take a look at another one. This patient was missing teeth at a young age, and so the orthodontist brought all her teeth back in. As they started kind of crumbling one by one, options, denture.
So that
Okay, can you imagine
young
putting
woman would have been in a denture.
in a denture? Now take a look at her.
Oh my goodness.
2 weeks later.
Does not look like the same person.
Can you imagine her?
legitimately.
Can you imagine her being in a denture? So if you have bad teeth like that on the before pictures,
Yeah.
she can't eat. She can't eat salads. She can't eat steak. She can't eat cold foods. Set her
Because it hurts?
Absolutely, yeah.
Okay.
So that a lot of sensitivity issues, but even more than that, you know what she told me?
What?
She was so excited to be able to look at herself in the mirror that this treatment had changed the way that she will forever take photos.
That's very nice.
Something simple like a family photo.
We're out of time. Final message. There's two groups of people that you've talked about. The denture wearers that you say don't even know their options, but the other people that have teeth but they're bleeding gums, the bad breath, and they feel like they're going to end up in a denture. Let's say they've heard everything you have to say today, but they're still skeptical or still afraid. What do you say to them?
My message to them is come in. Come to our office, come see us, and let's look at it. Let's sit down and let's talk. Yeah, let's talk and let's show you some of the options. And there's going to be an option there for you. And it's always difficult. I get it. It's hard to pick up and call. And
Because
just
people
start
don't like
action.
going to the dentist to begin with, right?
We're scary people. You know that we're scary people. No, I mean, we treat everybody like family. So I would invite you to come in and become part of our family, and we'll help you, with your dental problems.
Do they make an appointment online, or is the best thing to do just call the office?
Either one. You can book online or you can call our office.
Okay, good. I want to thank you for coming on the show. Good stuff.
Yeah, thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.